Are you ready to find out exactly how much you'll pay for Medicare in 2025? You might think you know the cost, but with premiums rising, deductibles changing, and new rules taking effect, it's more important than ever to understand what's coming. If you're approaching 65 already on Medicare or helping a loved one navigate the system, this video is going to save you time, money, and a lot of confusion. Stick with me until the end, because I'm going to break down everything in a way that's simple, clear, and easy to act on. Let's start with the basics. Medicare has different parts, and each part comes with its own costs. Part A covers hospital stays. Most people don't pay a premium for Part A because they or their spouse paid Medicare taxes while working. But that doesn't mean it's free. In 2025, if you haven't worked long enough to qualify for premium-free Part A, you could pay up to about $1,500 a month. And even with Part A, there are deductibles. For each hospital stay, you'll be responsible for around $1,600 before Medicare starts covering the cost. Keep in mind, if you stay longer than 60 days in a hospital, your daily coinsurance increases, which can add up fast if you're not prepared. Now let's talk about Part B, which covers doctors, outpatient care, and some preventive services. Nearly everyone pays a monthly premium for Part B. In 2025, the standard premium is roughly $175 per month. But here's where it gets tricky. Your premium might be higher depending on your income. If you earn over $89,000 a year as an individual or over $178,000 as a couple, your premium could be significantly higher. This is called the Income-Related Monthly Adjustment Amount, or IRMAA. Part B also comes with an annual deductible. In 2025, this deductible is set at about $225. Once you meet that deductible, you typically pay 20% of the Medicare-approved cost for most doctor services and outpatient care. That 20% might not sound like a lot, but it can quickly add up if you need multiple treatments, lab work, or imaging services. That's why many seniors consider a Medigap policy or a Medicare Advantage plan to help manage these costs. Speaking of which, Part D, the prescription drug plan, also has a monthly premium, which varies depending on the plan you choose. The average standard premium is expected to be around $40 per month in 2025. But just like Part B, if your income is higher, your premium could increase. Part D also has deductibles and coverage gaps, often referred to as the donut hole. The good news is that recent changes in Medicare have aimed to reduce out-of-pocket costs in the donut hole, especially for brand-name drugs. Many seniors ask me, "Doctor, how do I know which plan will cost me the least?" It's not just about the premiums. You have to consider deductibles, coinsurance, and out-of-pocket maximums. Some plans might have lower monthly premiums but higher deductibles. Others might cost more each month but save you money if you need frequent medical care or expensive medications. The key is to look at your health needs, your medications, and how often you see doctors or specialists. And here's something most people don't realize. If you miss enrolling during your initial enrollment period when you turn 65, you could face late enrollment penalties. For Part B, that penalty is added to your premium for as long as you have Part B. For Part D, you could also face a permanent penalty if you don't sign up when first eligible and go without credible prescription coverage for more than 63 days. That's why timing is everything when it comes to Medicare. Now let's talk about Medicare Advantage plans, also known as Part C. These plans are offered by private insurance companies and cover everything Part A and B cover, often including extra benefits like vision, dental, hearing, and wellness programs. Premiums for these plans can be as low as $0 per month, but you still pay your Part B premium. The trade-off is that each plan has its own rules, networks, and out-of-pocket limits, so you need to read the fine print carefully. In 2025, maximum out-of-pocket limits for Medicare Advantage plans will generally cap around $8,000 for in-network services. That cap can provide protection from catastrophic medical bills, which is something traditional Medicare doesn't do. Another important cost to consider is supplemental coverage. Medigap plans can help cover deductibles, coinsurance, and other out-of-pocket costs that original Medicare doesn't. Plan K and Plan L, for example, share costs with you but offer caps on your yearly out-of-pocket expenses. This is particularly useful for seniors who anticipate frequent hospital visits or specialized care. Here's a quick strategy tip. Take a few minutes to estimate your total healthcare spending for the year. Add your premiums, deductibles, coinsurance, and expected prescription costs. Compare this number with the cost of Medicare Advantage or Medigap plans. You might be surprised to see that a plan with a slightly higher monthly premium could actually save you hundreds or even thousands of dollars annually. Before I move on, I want to take a moment to tell you about Medicare Mentor. If you want personalized guidance to choose the right plan, understand the costs, and avoid penalties, Medicare Mentor is here to help. We specialize in helping seniors navigate these complicated decisions so you can focus on your health and peace of mind instead of paperwork. It's also worth noting that some costs are rising faster than others. Premiums for Part B are increasing steadily, while deductibles for Part A are adjusted annually. Prescription costs can be unpredictable, especially for brand-name medications. But there are tools and programs available to help reduce these costs. Extra Help, for instance, is a federal program that can lower your Part D premiums and copays if you meet certain income requirements. Finally, don't forget preventive services. Medicare covers a wide range of screenings, vaccines, and wellness visits at no additional cost to you. Using these benefits can help you catch health problems early, potentially avoiding more expensive treatment later. Staying proactive about your health isn't just good for your body, it's good for your wallet too. So, what does this all mean for 2025? Expect to pay your Part B premium, be mindful of deductibles for Parts A and B, watch for prescription drug costs under Part D, and carefully evaluate whether a Medicare Advantage or Medigap plan fits your situation. Planning ahead, reviewing your health needs, and comparing plans annually can save you thousands of dollars. Remember, Medicare isn't just about coverage. It's about protecting your health and your finances. By understanding the premiums, deductibles, and potential out-of-pocket costs in 2025, you're taking control of your healthcare, not leaving it to chance. Take a few minutes now to review your options. Make a list of your medications, doctors, and any planned procedures, and use that as your guide when comparing plans. By staying informed, you can make confident decisions that protect your health, your savings, and your peace of mind. Don't wait until the last minute. 2025 is just around the corner, and the right plan can make a world of difference. Take charge today. Review your Medicare costs, explore your options, and if you need help, Medicare Mentor is ready to guide you every step of the way. Your health, your money, and your future are worth it.